Okay, good morning, everyone. We are live, I'm told, so let's kick off. We are quorate, which is always a good start to the meeting. Welcome along to this morning's IJB meeting. We do have a few apologies and substitutions, so just run through them quickly. We have apologies from David McNiven. Apologies from Roger Ridley, and Tony Beekman is present online as substitute. And apologies from Sharon Mawani, and Amanda Winter is present in the room as substitute. Are there any other apologies? No. Are there any declarations of interest in relation to any items on today's agenda? No, not seeing anything, thank you. Okay, can we move then to the minute of the last meeting, which was held on 20th of March, seems like a long time ago now. I'll run through for accuracy. Is there anything anyone wants to raise on which page 4 of the papers?
No.
Page 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. This was a good idea, wasn't it? 16 and 17. Okay, there are no items on the action log to pick up, but are there any matters arising anyone wants to raise in relation to anything in the last meeting? Nope, not seeing any hands, real or virtual. So we'll move on to item 5 then, which is the Interim Chief Officer's report. Caroline.
Thank you, Chair. This report provides members with an overview of key developments at local, regional and national level which are relevant to the Integration Joint Board. First, in terms of governance, the revised integration scheme has been approved by Scottish ministers, extending the IJB's responsibilities and increasing voting membership. Children's and families, social care and social work, criminal justice services and prison healthcare are now all under the responsibility of the IJB. In terms of IJB membership and standing orders, notable changes include upcoming changes to board membership. That includes this being Alison Japp's last meeting, and following the council meeting yesterday, Councillor Murtagh has been appointed to join the IJB board. There's been updates to the standing orders, including care experience representation, and the updated document is available in Appendix 1. I just want to note that further governance updates will come to the September meeting. Moving on, I want to highlight the SPSO decision with regards to Tiggettshaw. The Ombudsman upheld a complaint regarding consultation and decision-making processes. The final decision notice from the SPSO is available in Appendix 2. The SPSO requested the partnership apologise and make the IJB aware of the content of the letter. Actions taken have been a formal apology being issued, and we have circulated this within the letter, and lessons learned have been embedded to improve consultation transparency and improve the impact assessment process. All clients affected have now transitioned to new care arrangements and have been reviewed with no significant care concerns identified. In terms of local updates, key highlights include the appointment of myself as the Interim Chief Officer and the appointment of Claire Chapman as the Interim Head of Community Services. There's ongoing engagement with the partnership through the Joint Staff Forum, and visible leadership visits continue to show positive practice and identify pressures across the services. IG members have also undertaken service visits, providing important insight into frontline delivery and challenges. In terms of national updates, there's been several important developments. The first is the extension of voting rights to lived experience members from September 2026. The new children care experience legislation. This has early implementation phased with recognised challenges. creation of the Public Services Delivery Scotland supporting national reform, and publication of the health life expectancy data, which highlights ongoing inequalities and system pressures. In terms of implications from this report, there is no direct implications, but in terms of workforce, it's limited to note the interim arrangements. In terms of risk, it's just recognising these continue to be managed through the standard processes. And in terms of the equality considerations, no decisions required, therefore no full impact assessment is needed at this stage. I just want to highlight in terms of the appendices, there's the standing orders, updated standing orders, the SPSO decision notice, the apology letter, and information with regards to the Public Services Delivery Scotland. Something that I want to add is in terms of an area not highlighted in the report is the GP walk-in centres. While work in this area continues to progress, I would like to update the board that following publication of the IGB reports, we've been invited by Scottish Government to develop a further proposal for a second GP walk-in centre. At this stage, we do not have additional details, but we will provide the updates as the work advances. Members are asked to consider and comment on the content of the report, and I'm happy to take any questions. Thank you, Chair.
Thanks, Caroline. Can I open up then for questions or comments from members? Councillor Hannah.
Thank you, Convener, and welcome, Caroline, and congratulations on your new position. I'm not sure congratulations are in order, but good luck. Right, in terms of the questions, the first one is that we're going to have quite a changeover in terms of the membership of the IJB. Do you have arrangements in place for additional training and development sessions in the autumn to enable new members to get up to speed as quickly as possible and enable those of us who are staying on to begin to develop good working relationships with new members?
So in terms as new members join the board, we're obviously making contact and are offering an introductory meeting, but we do have like formal induction processes that have been worked on, and we would plan to use them to welcome new members to the board, but also to make sure that people understand the remit and responsibilities that are within the board. But perhaps if I can invite Ewan to just add further detail around that.
Thank you, Caroline. Yeah, we've recently updated our induction pack for board members, so this gives an opportunity to really test drive that. I guess the other thing for me that we need to think about is how we use development sessions going forward in terms of that cohesiveness of the board and changing dynamics with that. I think that's really important to think about, and that's not a once and done thing. I think that's a continuous process. Thank you.
Thank you. Thank you, Convener. My second question is about the Ombudsman's decision. I wonder if you could tell me what specific changes have been implemented to improve consultation processes following the lessons learned exercise.
Just bring in video.
Thank you. Thanks, Councillor Hannah. So there's been a number of implemented decisions. So we undertook a lessons learned exercise following the complaints that were submitted. So there's a number of things. So what we're doing is providing more detailed and locally tailored information about impact proposals for the equalities impact proposals. But in relation to consultation, we're trying to reach as many people as possible. So for example, during this year's budget consultation, we put forward a proposal to increase social care charges. We wrote to every single person who would be affected by that change. And we also had drop-in sessions in all of the housing and care centres and in local libraries, and in a number of areas. We tried to cover as many areas as possible. So we've tried as much as possible to have a much wider reach, and that included even issuing paper copies that were requested. So we did have a much larger number of people come and take part in the in-person consultations, which was really positive. What we're also doing is involving carers reps, service user reps, etc., and lived experience reps, we're asking them to look at our consultation questions and give us feedback on, are they understandable? Do people know what that means? And we're also making sure that we're engaging with staff as much as possible as well. So there's been a number of areas, and they're set out in the appendix as well. So I won't go through every single thing, but there's a number of them set out in that response letter as well. But I'm happy to answer any further questions that you might have. Thanks.
Thank you very much for that. Can you maybe say something about how you're going to be ensuring that the lessons learned are embedded not just in the housing with care sector, but across all of our service areas?
So if I take the example in terms of transformation, what we have is a working group that ensures that we sense check every change that we're proposing. Within that, what it does is it considers the stakeholders that may be impacted and makes sure that we're consulting directly with these stakeholders. So if I take the example of the care at home redesign, which is currently out for consultation, as part of that process, we've written to every client that receives a care at home service. We've also written to all staff that work within the service. We've had drop-ins with the staff. We've also had briefing sessions with the trade union colleagues. And, we've shared written briefings around elected members as well as the IJB board to make sure that everyone's aware of this is what we're consulting on, this is what we're considering, and that would inform the proposal going forward.
Okay, and that partly, but not entirely, answers my next question, which is how are we going to ensure that kind of public confidence is being restored, because it was quite a difficult period?
So if I perhaps start, so one of the things that we're doing is we're putting all the transformation projects on our website so that there's transparency around how we're taking things forward, and the plan is that we'll update them as we go through the projects. And it's very clear about who the point of contact is if you want further information. We're working, in terms of our comms and engagement to make sure that we've got a structured, consistent approach about how we take things forward. And we think that'll, help rebuild that relationship with the public, because we recognise that's key. It's a key stakeholder, not just people that directly receive services, but the wider public have to have confidence around how we deliver our services and how we make change.
Thank you, convener.
Okay, thanks. Tom, did you want to come in on this specific issue?
If I may. I'm okay. Now can I speak? Yeah. Oh, right, sorry. It's been a wee while. Thank you very much. Can I maybe just come in on something about public confidence and public's expectation and understanding of what's going on? And one of the features or the characteristics often of strategic planning, strategic plans, is that people don't necessarily see them as themselves bearing any direct relationship with decisions that are subsequently made. And we've taken that on board. And actually, our new strategic plan coming out this year should, in many respects, describe the roadmap for our strategic direction, which then allows an understanding of any subsequent decisions that require to be made, where they are embedded strategically, so part of our overall planning. So whilst they may affect individual aspects of things that we do, that there should be at least an acknowledgement that it would be the decision is consistent with their strategic direction. And it has been sometimes that disconnect that has created a situation in which people think a decision about something comes out of nowhere. Now, it rarely does, but it feels like that. And so I think it's quite an important facet of our future strategic planning that there is a correlation between where we said we are going to go strategic, which is after all a public endorsement and a public creation and a mandate for going in direction where subsequent decisions sit.
Thank you for that. I think that's a really important point, because I think sometimes there are directions of travel that we are taking that are implicit and that we all understand, but the public out there don't. because we don't actually say it. So I think that is really, really important. So thank you for that.
Kate, thank you. So some very important points there. Can I bring Tony in next, and then Councillor Colley?
Thank you. Tony Beekman from Unison. I would just like to follow up on Councillor Hannah's very useful questions. The staff involved, as well as the residents and families, were really upset and demoralised at the Ticket Show decision. I know time has moved on now, and the staff have moved on, but I think it's fair to say that the preference of staff and residents would have been to have kept the service as it was, that it was a great service, and it's commendable about the staff, the residents, and the family seem to have a bit of a community feel. So it was a great service, and a credit to all concerned. So it's a pity, and I realise a lot of it is down to councils and HSCPs not being funded properly from central government. But could one of the lessons learned be that, you know, if a proposal has been put forward for budgetary reasons, can we just admit that and not try to dress things up as it's an alternative service and it's just as good? You know, if we have to say this is the best we can do, then maybe that's all that can be done. But can we not try to pretend something is good when it's a cut? And in that regard, later on in the agenda, there's a bit about the promise, and I think the approach there to say, yeah, there are good proposals here, but the money and the resources haven't followed it. I think that is a good approach, and I hope I'll say something that everybody can agree with, that councils and health and social care partnerships do really important work, and they deserve the funding to go with it.
Thanks, Tony. I won't come back on the specifics, but on the general point, yeah, we know we have some difficult decisions to make that we would rather not be in the position of having to make, but unfortunately that's where we are as a body, and we need to try to make sure we do the best with the money we have for the people across Falkirk. Councillor Colley, can I bring you in next?
Thank you. I won't labour any of the other points that have already been raised. I also want to congratulate Caroline and Claire in their new roles, and also to just acknowledge Alison's contribution. And I've certainly learned a great deal from Alison in her time, both on the IJB and also on the NHS board. So thank you, Alison. I've got a couple of small questions, and they're around the involvement, the extension of voting rights, which I think the IJB supported in terms of our response to government in relation to that, and I think it's really important that we have the effective support systems in place to enable individuals to take part effectively and be supported throughout that. I think that I had a question around the support for lived experience. The lived experience representative. I think I have a clearer picture of the support around the carer reps and the Carer Voice project and the Carer Centre, and how that provides both a sounding board but also a level of support and able to have discussion. I think I'm probably a little less clear around what support is available for the lived experience representative and what backup is available there, and equally that kind of sounding board of other individuals with lived experience in the area. That's my first question. My second question is around the care experience member, and I know that there's a request around a nomination from the Champs board, but I suppose it's a similar question around that wider support for care experience representatives, potentially substitutes, and it's probably one for Sarah maybe, but just how do we effectively involve that obviously there's a wider experience of people with care experience be involved in some of the council meetings, but this is a kind of different forum, different decisions, and how do we really support someone to be involved effectively?
So I might start and Sarah might come in. Obviously, Ewan set out that we're looking at an induction for new members, and as much as possible, all of the officers will be there to support any new members that are coming onto the IJB. We have a series of meetings that we tend to meet regularly with IJB members and on request, so that will absolutely be available to people as well. And obviously we work fairly closely with the Carer Centre and with David McNiven, who's not with us this morning. Obviously, his apologies are in, so we're going to continue that. David's been fairly highly involved in the creation of the induction pack as well. He's been working with us around what his experience has been and how we might improve that. So I know Ewan set out that we're working on that as well, but absolutely all of the officers will be available to any members that are coming forward to support them. And Sarah might have something to add. Thanks.
So we have, as you know, been on a journey in terms of full integration. So we've had a year as we've made our way through to having the scheme of integration signed off. And throughout that period, there's been lots of activity in place, fundamentally guided through a programme board that we had in place to support a lot of actions, a very significant action log that we had around integration of children's and justice.
Can I just quickly, that's really, I know how meaningful, actually really meaningful it's been to have the care experience member involved in the executive and the education executive. I think it's really contributed a great deal to members' understandings and decision making. So I think it's been a really important development. There was a bit of my question around the lived experience rep that was about that kind of sounding board and wider support around other individuals with lived experience, and kind of trying to understand about that connection into the wider community for the lived experience representative. Obviously it's David just now, but that kind of, as we move forward, how do we ensure that wider support and that wider sounding board is there as well?
We can certainly pick that up, Councillor Colley, and make sure that we're getting that support in place. One thing I was going to add as well is about IJB development sessions. Ewan mentioned that, thinking about how we use those moving forward. I think we shouldn't underestimate the support of other IJB members as well. That's a really good place for that support to take place and for that sharing of knowledge to take place as well. Thank you.
Maybe can I come in there, please? Hello. Can I come in, please, on that point from Councillor Colley? It's Victoria.
Okay, on you go, Victoria.
Thank you. So I totally agree with Councillor Colley that we need to make sure that our third sector reps and lived experience reps are completely supported throughout this process. And it is just to let you all know that we feel that as CBS Falkirk, the third sector interface, we have a role to play within that. And therefore, we are seeking some guidance and support in creating some sort of project about growing that peer support in order to be able to support not just the lived experience reps, but like that, our carers reps and our third sector reps, and not just within IJB, but within all strategic partnerships that are actively welcoming and valuing their voice within these strategic partnerships. So I will keep you up updated, and Councillor Colley and Sarah, if perhaps we get together and have another conversation offline, because I would really appreciate your input into that as well. Thank you.
Okay, thanks, Victoria. Yeah, I mean, I think there are a number of conversations that quite a few of us need to have offline. In this does need to be about meaningful involvement, and that involves supporting people. It's not simply about adding new voting members for the sake of it. They need to feel welcomed, able to contribute, and we need to listen to what they bring to the table, which is very important. So we will take those conversations forward between meetings. There's also, I think, still some further guidance to come out from Scottish Government in terms of the implementation, which is from September. So we'll bring that back to next meeting. Okay, Councillor Malta, welcome. Can I bring you in?
Thank you, and thanks for the welcome. I just wanted to input at this stage that having been a member for less than 24 hours, I'm probably just going to observe today, and I haven't had the induction and training, but I just want to say that I've certainly felt very welcome from the number of emails I had almost within minutes of being appointed, and really grateful to officers for reaching out and hopefully connecting on that. So I can see that the process definitely works in terms of welcoming a new member. I think I just want to input obviously on some of the substantive issues that have been raised in terms of the lessons learned, and I've met with officers in general about the issues raised on the equality and poverty impact assessment, and look forward to be able to contribute more on that. But could you say a bit more in terms of, you were saying about widening consultation, but in terms of perhaps refocusing on impact and how plans of kind of learning from what's been put forward in that exercise, how whether sort of tweaking questions about understanding what the real impact might be on service users, and how we can reflect that in decision making would be helpful. Thank you.
Thanks, Councillor Malta, and welcome to the IJB from me as well. So obviously, those lessons learned carried out undertook the budget consultation and the EPIA process. So part of that was about making sure that we are bringing forward those impact assessments earlier and considering them much earlier in the process. Previously, as savings were being developed, they tended to come towards the end of that process. So what we're now doing is that any developments that are happening, we're going to bring those forward much earlier and consider them much earlier, take them through our staff developments, our extended SMT development sessions, through IJB development sessions where possible as well. If we're understanding impacts as we're bringing forward proposals, we can start to talk about them much earlier in the process, and making sure that all stakeholders are considered at that really early stage as well. So hopefully that will inform decisions a bit better moving forward. Thanks.
Okay, thanks, Marie. Some very interesting and relevant discussions there, some really key issues. So in terms of the report, we were asked to consider and comment. I think the board has done that very ably, so I'll move us on. Item 6 then is the financial outturn report for financial year 25-26. Marie.
Thanks, Chair. This is the outturn report, and it sets out the final outturn position for the IJB revenue budgets for 25-26. A final outturn of 4.451 million of an overspend was returned at 31st of March for integrated budgets, which was an improved position on that projected by 1.7 million. Set-aside budgets had a final overspend of 5.066 million, which was managed by NHS Forth Valley, as it has been each year of the IJB. The final overspend was addressed by agreed risk share contributions from both partners and reflects a request to earmark 1.5 million for use to balance next year's financial position, which IJB members heard in March when they approved the medium-term financial plan. Services in relation to social care overspent by 6.6 million, with the main variances set out in section 6 in the report, and are as follows. Care and support at home services overspent by 2.6 million, mainly in relation to the external provision demand, and was supported by an underspend in the in-house service, which was reported throughout the year to the IJB. The care at home redesign is progressing, which will address this budget imbalance moving forward. In-house residential services showed a final overspend of £1 million, mainly due to supporting safe staffing levels in our residential units. The bedded care review is underway and is expected to bring solutions to addressing the underlying overspend and meeting efficiencies set out in the medium-term financial plan. External residential care had a final overspend of £500,000, which was an improvement on the last projected position by £600,000. Continued management of placements and the effect of shifting the balance of care on long-term care contributed to the improved position. Recurring development funds helped to offset overspends in year, with an underspend of £800,000 at the year end. NHS services within the IJB budget underspent by £2.1 million. This final underspend was used to offset the overall social care overspend. The underspend was mainly in relation to vacancies throughout all services, offset by an overspend in complex care provision, which again was projected throughout the year. The projected overspend on primary care prescribing at Q3 was alleviated by additional funding which was provided by NHS Forth Valley of £1.5 million, which improved the overall position and allowed the earmarking of that £1.5 million to address next year's budget gap. And I'm asking members to approve that earmarking today. Savings targeted for 25/6 totalled £11.4 million, and £10.4 million of this total was achieved in year. The remaining £1 million has been carried into 26/7 for achievement and will be monitored alongside 26/7 savings through the Transformation Board. Appendix 4 to the paper shows the details of individual savings and amounts achieved in year. Budgetary control measures implemented in 24/5 continued for 25/6 financial year and will remain in place moving forward, and these are set out at 7.1 in the report. The 26/7 medium-term financial plan was approved by the IJB in March and set out a remaining budget gap of £14 million over the 5-year term. The Audit Scotland IJB Finance Bulletin for 24/25 was published in February and set out a challenging position with a budget gap of almost £450 million across Scotland for IJBs. It set out recommendations including collaborative working and reduced reliance on reserves. The improved position has allowed Falkirk to maintain the contingency reserve balance of £2.4 million, which is 0.81% of budgets and within the target set of 0.75%. There is a typo on that percentage at 5.4 in the report, my apologies. We are in fact within our target and not way below it as that suggests. Year-end reserves showed an increase on the opening position due to a number of funds held which are committed for future use, including slippage funds from Scottish Government for care packages in relation to winter discharges from hospital, the earmarking for next year's budget already mentioned, the £2 million of funds for continuation of shifting the balance of care for 26/7, and some additional funds in relation to prevention work and weight loss drug tests of change. Full details of all reserves held and the movement in year are set out in Appendix 5. 5.5 and 5.6 in the report set out requests to allocate some reserves funding for transformation support of £500,000 and for £15,000 of small grants funding for each of our 3 localities to allow tests of change in community projects, with monitoring information to be gathered to inform any future similar programmes. There are a number of ongoing risks to the financial position, including pay awards, demographic pressures, outstanding job evaluations and inflationary and volume challenges within prescribing budgets. Although the final, more favourable position is welcomed, the longer-term challenges remain and delivery of our efficiency programme will be key moving forward. If I could just take us to the recommendations section, I'm asking members to note the final draft outturn for integrated budgets and set-aside services. Note that the 2.159 general underspend in health has been utilised to offset the overspend in social care. Approve the earmarking of £1.5 million towards balancing the budget shortfall for 26/7. Approve the reserves adjustments set out in paragraph 5.5, and it should say and 5.6, just for noting in the minute. So it's 2 paragraphs, sorry. I've only said 5.5 there, so it includes 5.6 as well. Note the final non-recurring reserves position and authorise the Interim Chief Officer to issue revised directions to the Council and NHS Forth Valley per Appendix 7. Thank you. I'm happy to take any questions.
Thanks, Marie. It's always such a complex picture with so many adjustments, but I think your summary there was a good one. It's it's not a great position, but at least some of the adjustments at year end have gone in the right direction, and we are in slightly better position than we feared we might be. I think the fact that we are able to maintain that 0.75% reserve gives us some little cushion, and I certainly think that is a crucial point moving ahead into the new year. Okay, Councillor Hannah, I'll bring you in first.
Thank you, Convener. I would echo the congratulations to Marie and all the officers who have brought in and a not happy but balanced position. It has obviously taken a huge amount of work to get there, so well done on that. I wonder if you could say a little bit more about the reserves position. I mean, there have in the past been comments about, oh, well, IJBs have got all these reserves. So what are they complaining about in terms of their financial position? So I wonder if you could say a little more about the scale of the reserves, why we have them and what their purpose is.
So obviously members will see that the reserves position has actually increased for 25-26, which seems a bit at odds with the position that we're reporting of an overspend during the year. So there are a number of things there. So obviously I mentioned in my introduction a number of funds that have come over. So including the shift in the balance of care balance of £2 million, which NHS Forth Valley have made available at the year end for use in 26/7. So that's sitting there as a committed balance. There's the £1.5 million that we're earmarking. So it's sitting as part of the reserves balance as well, but we will be using that going forward. And so in the slippage funding, so there's 2.5 million of slippage funding from Scottish Government, which is already committed for care packages in 26/7. So although it's all sitting within the reserves balance at the year end, the majority of that reserves balance is committed for next year and for future years. So there are a number of areas where it's specific Scottish Government funding or specific mental health funding, which all sit within our reserves, but actually the majority of it is committed. So holding those contingency reserves, and we do have a bit of service pressures reserve as well, which we might be able to utilise next year. So also in addition to those funds that come over from NHS Forth Valley, there's an additional amount around prison healthcare. So there's a risk around the prison healthcare position as well. So they've made available additional funds for that as well. However, we may still have that funded from Scottish Government, but if not, it's available for use next year. So I'll continue to report that to the IJB during the year, whether we need that money or whether we don't. It won't become apparent until probably towards the end of the year. So although there are significant balances there, it doesn't mean they're not committed. The majority of that balance is committed, and the contingency in a small amount of those service pressures reserves is not committed yet. So although it looks healthy, and you know, I did say it's really welcome that we've been able to maintain those contingency reserves, there are still a number of risks around that position. One being outstanding job evaluations. So where if we had no contingency reserves left, the conversations may have been around partners having to contribute to that. Because we have those contingency reserves, it's likely that we'll have to pick those up if they come forward, if any backdated arrangements come forward. So it just means, I suppose I can't stress enough that relationship with partners is really good, and we have that really good conversation continually with the Chief Exec and the Chief Finance Officers of both organisations. That's been really helpful over the last 2 years since I've been in post, and those risk share agreements have been really helpful as well. Falkirk Council also agreed recurring funding moving forward for 26/7 and moving forward, which again is invaluable for us. It lets us reduce that reliance on non-recurring reserves, although we're still having to do that to an extent. We're using £1.5 million of non-recurring reserves to balance the budget for 26/7. That recurring funding is really helpful to help us reduce that. And as we work towards trying to fill that 14 million gap that we still have over 5 years, that small cushion that we have helps us to maybe look at test a change or bring forward proposals that we might be able to look at that whole system change in the future. Sorry, that was a bit long-winded, but I hope that helped.
I would describe it as thorough rather than long-winded. So thank you for that. Obviously, no further questions on that very thorough answer. But the second question I have is about the social care pressures. Clearly, the overspend on social care is a matter of concern. And in the context of our overalls, which are to increase the care in the community to try and enable more people to be kept in their own homes. What are the ways in which we're going to be able to achieve that?
So I might start. Others might want to come in on this as well. So obviously we've started that work with the shift in the balance of care. So yeah, absolutely, we want to have more care in the community. We want to take that focus away from hospitals, from hospital care, and have that as the last resort. We are looking at other options around what might primary care help us with. That's currently being delivered in secondary care. So it's looking at that whole system approach. I think for me, the demographic pressure that's built into the medium-term financial plan, and I was clear in the report in March that the amount of pressure I've put in for care and support at home for 26/7 allows us to stand still. There is no increase there. We're continuing with those budget management measures that are set out in the report. I think it's section 7. So we're continuing with resource allocation panels, management of long-term care placements, making sure that we've got limits of hours that we can allocate each week, because obviously, yes, we would want everybody to have the care that they need. We absolutely need equity, but we have to take that in a risk-based approach around the financial position as well. It's not an ideal position to be in, but as much as possible, it's about equity and making sure that we're taking that risk-based approach through those resource allocation panels as well, making sure that we're not overspending, but it being the right decision for the whole system as well. So we're continuing those conversations as a management team as well. I don't know if Caroline wants to come in.
So just to add to what Marie's kind of covered in terms of that, kind of grip and control around the budget, I guess they're the measures that she was referencing there. The transformation programme is very much about how do we transform our services so that we can strengthen our offer in terms of social care, and look at how we can really re-able people so that they can achieve their potential. But we know when we do that, that also will have a positive impact on the budget measures, and it should reduce spend. So a lot of our initiatives are about, very much about how do we modernise, transform our service, but keeping in mind that that'll have a positive impact on the budget measures. And it may well be that some of what we have to do is we have to increase our spend in certain areas, but we think whole system that'll have a positive impact in terms of the budget. And there's some of the things that we're exploring right now and taking forward in terms of the proposals.
Thank you for that. It kind of gives me a supplementary, which is what arrangements have we got in place for measuring this? One of the biggest difficulties that we have is where there is transformation in the service, in order to bring the costs down, which it should do. And we all know that's the right direction of travel. But what arrangements do we have in place for actually quantifying that? Because I think it's one of the biggest difficulties is being able to say, well, actually, by doing this, we have actually reduced the pressures elsewhere. We have actually reduced the demands on acute services, on other things. I know that's a big question, but as far as you can, if you could highlight what we're doing to try and get some tangible evidence of the results.
If I maybe start, so I'm not going to lie, that is a challenge because it is about, so data quality can be an issue, but actually numbers are easier to count. But actually what impact does that have on individuals as well? And it's individuals across the whole system that you're trying to measure. So if you do one thing over there, what impact does that have on that individual that's receiving the service, but also in a whole system measure, what impact is that having on individuals across the system? And that's something I think that we're very much, it's a work in progress. We're looking at methodology from other areas, but also methodology that some, for example, the care inspectorate has in terms of when they're doing inspections and looking at the kind of measures about what matters to an individual and how do you measure outcomes in a way that really captures that impact on life experience. So it's something that it's an area that we're very much working on right now, and we're going to be testing things out probably within the care at home redesign. So as we make changes, so if I take the care at home redesign, one of the key parts of it is about that reablement offer, but also having an urgent response service so that we can respond to people that perhaps need that social care input, but it would prevent perhaps like further admission into other settings, whether that be care home or hospital. So, we can see, we're thinking what would be the impact on the individual receiving that service, what's the quality of that service, as well as what it impacts in terms of their outcomes, but also, looking at the data across. So during that period when we had that service, was there changes in data points across the service that then we can analyse and kind of work out, well, by doing that, it had an impact on that. So it is very much a work in progress, and it probably links to that, our performance reporting, and it's an area that we're certainly working on. So hopefully that provides reassurance.
Thank you, and I look forward to hearing more as we go forward. Thank you, Convener.
Yeah, it is a massive question, and there's work going on at national level on this as well, because everyone is struggling with the same sort of issues, and that ability to make the direct links between if A happens, then B doesn't happen. And there's also the difficulty sometimes of trying to measure when things aren't happening is not as easy as measuring when things are happening. So I think there's a whole number of complexities here that everyone is grappling with. Councillor Colley, can I bring you in, and then Alison?
Yes, my head started to hurt about that, measuring things that are and aren't happening. But I was it's in relation to reablement, and I just wanted to just in general comment. I think that you can see through some of the things around shifting the balance of care, but actually what a difference the reablement approach makes. And I'm thinking it must be over a decade, but it might be even longer than that. I was at the Carer Centre in Angus, and they'd been doing work on reablement, and the measurement that they were able to provide for the individuals, but also for carers, and the difference that was making. So I think I think probably if you ask most people what they want to be able to do a lot of the things that they used to be able to do before they had a disability, got a bit older, had an accident, whatever. That's the thing that they want to do. And as much as possible, if being able to build our services around helping people to get back to a point in time where they were able to do some of those things. Maybe it might be in a different way, but that actually I think it's a really it's a positive approach, and I think it's positive in terms of the outcomes for individuals. And at some point I'll tell you all about realistic medicine, DANS, and pain management and sickle cell. So just, but that's probably not for this meeting. I wanted to make a comment on the delivery of savings, and I think for all that they haven't been completely achieved, I think I want to pay testament to the work involved in actually delivering the level of savings that the team have managed to do. Because if we don't deliver those savings, we are actually in a generally better position than a lot of other partnerships. Not to say it's not difficult, but that we are in a generally better position. But if we don't make the decisions and make some of the savings and be clear where savings are savings, but also transformation, I think I think we in general are across a lot of not just our policy plans, but in terms of our budgets, that we're pointing everything and we're pointing things in the positive direction. And the final point was I just wanted to ask a little bit about the locality small grants, and I know it's a tiny thing in the overall budget, but just a little bit about just to say a little bit more about it and what's the thinking about bringing that in.
Yeah, thanks. So obviously I'd set out it's £15,000 for each locality, so it's starting small. I've been having discussions with Victoria, so through CVS we're going to be bringing forward a paper around CVS managing that process for us and looking at criteria for those. They're used to running these types of grant programmes, so they're absolutely key to this process as well. So I'll be bringing forward a paper to the senior leadership team around that. So they'll manage the process. They will gather monitoring information on the outcomes of any of those small grants. So we're talking about, limits of, how many. We haven't set that yet. We're still having conversations about what the limit on each grant might be, what the criteria might be, and that will be decided in conjunction with appropriate groups. So it will be over this financial year, and we'll have monitoring reports coming back to the IJB before we agree next year's budget, with a view to looking at the impact that those have had. And I expect there will be a positive impact, and if that's the case, then we can look at potentially putting in some recurring funds and what other opportunities might be there after the first year of that programme. Thanks.
Okay, thank you. We'll look forward to seeing that. Alison, thank you for waiting. Can I bring you in now?
No, thank you. And I think I'd just like to echo some of those comments that actually, if you look at how much of the original planned savings were made, it is quite an achievement to have delivered that. And I've got really a couple of questions that follow on from some of the discussion so far. And the first one is coming back to the reserves conversation. And I think Marie, your explanation of committee versus contingency was incredibly helpful. But I think what would be my ask going forward is, can we actually see that in our reporting? Because the contingency elements are important to understand what that is and what is not committed. So it was really just an ask to cover that off in future reporting. I'm going to take my headset off because I think I'm getting reverb for everyone. So just hang on a sec. Hopefully that's a little bit better and you're not getting the noise kind of coming through. So the first question was really just about that committed versus contingency. The second piece is, Marie, you also outlined we've got a number of risks that are still outstanding. And I think we've been talking about these risks for some time. And I wonder if you can give us a view of when some of those might crystallise and when we will know about the size of those risks. Because they do introduce then additional budgetary challenges that we will need to meet in some way. And then the third question is around that risk balance and the budget balance, because you outlined very clearly that there are choices here and that we are making decisions at an operational level that are balancing what we have within a budget and the risk to service users there. And I think we're always going to have to make that, and you're always, as a senior management team, having to make those choices. And from an IJB perspective, board perspective, one of the challenges I think I've got is, how do we get more visibility of that so that we understand if there are any risks that we then start to become uncomfortable about making with that budget trade-off? Because we really don't have any sense of how severe some of those risks are. And I'm not sure you'll have an answer today, but it's really just something to reflect on, and how do we make that level of risk more visible? And that was it.
Yeah, thanks, Alison. So I suppose to pick up your first one around the reserves position. So Appendix 5 sets out the full reserves position. So I suppose I should have referred people to that at the time. But what you'll see in Appendix 5 is that the balance at the year end is 21.3 million, committed is 17 million. So although it's in Appendix 5, I take your point about, highlighting where we are with those each time. So I'll take that on board and maybe pull into the narrative of the report just a bit of additional information about how we anticipate what's happening with the contingency reserves. Around the crystallisation of the risks. So for me, one of the biggest risks that we have is delivery of the efficiency programme and the transformation programme. So we do have monthly meetings of our strategic planning and transformation board where that will be monitored. One of the Audit Scotland points for every IJB and every council is that we're more transparent about savings reportings and whether they're permanent or whether they're non-recurring and how we're meeting those. So although I feel I'm fairly transparent around what we're meeting and what we aren't on that savings appendix, I'm taking that on board just maybe to bring in additional information where we're maybe not meeting those savings targets, to highlight them to the IJB as soon as possible. Around job evaluations, we don't know the outcomes of those yet, so that's an ongoing process. It can be a fairly lengthy process, so as soon as I know, the IJB will know, so I will report that, obviously. Normally, I had committed to quarterly finance reports last year, but what I did was bring a finance report to every IJB, almost every IJB, apart from one, just to make sure that we were up to date with that position, that everybody was absolutely aware where we were. And around the risks, Ewan's been doing a bit of work, obviously, with IJB and development sessions around risk appetite and the update of the strategic risk register. So for me, if there are any emerging risks that are becoming, if they're moving up that risk register, then they're monitored through the Performance Audit and Assurance Committee, and that report provides that committee provides an assurance report to the IJB after every meeting. So if there's anything in particular that the PAC committee want to highlight, that would come to the IJB through that assurance report as well. So there would be visibility for IJB through that report as well. Obviously, in the strategic risk register, financial sustainability sits at very high. I don't see that changing anytime soon, to be honest, although yeah, the target would be lower than very high. Nobody wants their financial sustainability risk to be sitting at very high. But we've still got that £14 million budget gap. We still have a number of risks in there. So I think it's absolutely at the right level at the moment. But as I say, Ewan's been doing a fair bit of work around deep dives for the strategic risk register, updating it. And we're also looking to move that onto the council's Pentana system so that it's being updated more regularly. There's more visibility, clearer reporting around that as well. So that if there's anything to be highlighted, that can come to the IJB as quickly as possible. Hope that helps.
I think maybe just the challenge in that is just getting that speed of escalation in terms of how do you get the evidence behind when is that risk of service users harm escalating or not, because we've obviously got the strategic risk around the finances, but we almost don't have a strategic risk the other way around. So it's how do we just get that balance? And I completely agree, we're now getting to the point where we have the structures in place, but they're only as good as the information flowing through. So it's really just that question to think about if that risk profile of what's coming through in those allocation sessions, if we are then starting to see a change, how does that then flow through so that there is early visibility and that we've got that really, really clear, because I think that just protects everyone. And allows that balance to be had in these discussions, because yes, we have got to deliver a balanced budget, but we're also then trying to ensure that we're doing the best for the people of Falkirk, and it's just where are those trade-offs? I think we need to constantly be having that conversation, being conscious of where we're making those trade-offs. That was it for me.
Yeah, I suppose just to come back quickly, Alison, on that, through those resource allocation panels, I know we've been looking at the processes there as well and making sure that we've got oversight of the risk across the board, and what does a waiting list look like? If we've got a waiting list, what does that look like, and where do the risks lie, to make sure that the people who are making those decisions around resource allocation absolutely understand that risk across the board, and they would be able to escalate that to senior management and accordingly if there was anything, if that risk was escalating, and making sure that we've got those processes in place. Thanks.
Yeah, thank you.
Okay, thanks, Marie. Yeah, I mean that tension between increased demand and not increase the budget is very much at the heart of where we are as a board and the decisions we have to make on a strategic basis going forward. Okay, if there are no other questions around the room, real or virtual, I'm going to take us to the recommendations. Given that they are important, I do want to run through these one by one just to make sure that we are taking decisions as we should. So 2.1 is note the final draft outturn from budgets and set aside services. Is that agreed? Duly noted. Note that 2.159 million general underspend in health has been utilised to offset the overspend in social care. Is that duly noted? Approve the earmarking of 1.5 towards balancing the budget as set out there. Is that agreed? Approve the reserves adjustments set out in paragraphs 5.5 and 5.6. Is that agreed? Note the final non-recurring reserves position and authorise the interim chief officer to issue appropriate delegations based on. Nope. Are we happy then to approve the annual assurance statement as set out in the report? Okay, thank you. So it's 10:35. I'm going to suggest we come back at 10:50. Thanks, everyone.
Who's here? Who's here? Who's here?
Okay, we are live again, folks. Can we get started? Okay, thank you, everyone. So item 8 then is the annual performance report for 25-26. I think Helen is going to introduce this one.
Thank you. Yes, good morning, everybody. This report provides assurance on our delivery against the strategic plan and national health and wellbeing outcomes over the past year. Overall, it sets out a position of steady progress in a highly pressurised system. We have continued to shift care closer to home and support more people to live independently while also managing sustained demand, workforce pressures and system flow challenges. I'll highlight 3 key areas this morning: where we've made strong progress, where we are experiencing pressure, and what we're going to do next. Firstly, there are a number of clear successes to recognise. We've continued to strengthen community-based support, enabling more people to remain at home and avoid admission where appropriate. This reflects our strategic direction and is having a positive impact on independence and experience of care. Next, we're seeing encouraging progress in services that focus on recovery, re-enablement and re-enablement-led discharge. These approaches are helping people regain independence more quickly after periods of illness or crisis. Across the system, there's been strong partnership working, particularly in managing winter pressures and responding to demand. While not always visible in headline performance, this has been critical in maintaining service delivery. There has been continued progress in shifting towards prevention, although this remains a long-term endeavour. The foundations we are putting in place are now essential for future sustainability. Overall, we are seeing tangible progress in delivering this strategic shift towards prevention, community care and independence. Alongside these successes, the report is clear that we are operating in a challenging and constrained environment. Demand continues to rise with increasing complexity of need across both health and social care. This is placing sustained pressure on services across the whole system. Flow through the system remains fragile at times. While there have been periods of improvement, delayed discharge continues to be an area requiring focused attention and whole system collaboration. Workforce challenges remain one of our most significant constraints. Recruitment and retention issues, particularly in key roles, affect both capacity and resilience within services. And like many partnerships, we are managing a gap between growing demand and available resource. This reinforces the need to prioritise effectively and continue to shift towards more sustainable models of care. You will note the national indicator was referenced in the report. However, this data is not the most up-to-date and will be refreshed in the final version when stats are available in July. The narrative in the report provides a more accurate reflection of current performance. Overall, while we're delivering progress, the system remains under sustained pressure and requires ongoing adaptation. The report also sets out a clear focus on improvement and next steps. We're continuing to prioritise actions to improve flow, including enhancing discharge pathways, strengthening community alternatives, and working closely with acute partners. A key priority is aligning our workforce planning with emerging regional plans for 2027 to 2030, ensuring better alignment with service demand, focus on critical roles, and development of new models of care. We'll continue to build capacity in community services, which is essential to reducing pressure on hospital-based care and supporting prevention. We're strengthening our approach to performance reporting to ensure clearer insight for IJB, better alignment to outcomes, and more timely and meaningful data. Despite pressures, we remain committed to prevention and early intervention as the most sustainable long-term approach. Overall, our focus is on targeted, realistic improvement that strengthens resilience and supports our long-term strategic direction. So in summary, we've made meaningful progress, particularly in community-based care and supporting independence. We continue to face significant system pressures, particularly in demand, flow and workforce. And we have a clear, pragmatic plan for improvement aligned to our strategic priorities.
Thanks, Helen. Yeah, it's a very good summary of the progress we're making, the direction we're taking, but also the challenges that we know we face. David, did you want to come in?
Thanks, Chair. Yeah, I thought this was a really interesting report, an excellent report. The National Indicator number 6 for GPs. I was going to comment on how it's out of date because the new Hays survey is given a new report. What you can see is a big drop in satisfaction during COVID and then a steady increase. And this year it's up to 73%. So it's steadily increasing, which is positive, I think, getting back to where we were pre-COVID. At the end of the report, there was a kind of summary and a looking ahead. And for such an in-depth, detailed report, I thought that was maybe a bit short, and I was hoping that this report would be referenced in future for other decisions that are made by the IJB and strategic aims made, because there's a lot of stuff in there The one thing that really stood out to me was the readmission rate for us in Forth Valley again, and unfortunately not really any progress in the last six or 7 years. We're a long way above the comparator, the national comparator, which is 103 per 1,000 population. We're sitting at 141 per 1,000 population. So I think that is a particular area that needs a bit of focus and needs some strategic priorities around that. And that hasn't been drawn out of the report. So just hoping that this report will be used for other things going forward, other meetings, other strategic planning. Thanks.
Okay, thank you, David. Yeah, that's something we can think about in terms of strategic planning. Are there other questions or comments members wish to make? Ian, can I bring you in?
Thank you, Chair. Yes, an excellent report as well. And whilst I'm very pleased to see and hear Helen talk about the shift towards prevention and early intervention, we're obviously also aware that during this financial year there was significant cuts to third sector funding, who predominantly would work in the area of early intervention and prevention. So I think it would be really good, and I'm involved in the planning of the new strategic plan, which is good. I think it's really good to acknowledge that in the new strategic plan and acknowledge that the third sector do undertake a lot of the work that our wider strategy is hopefully going to deliver, and that we're mindful of that in the years ahead.
Yep, well said, Ian. Thank you. Tom, can I bring you in?
Yes, thank you very much, Chair, and for yourself. Thanks very much for your comments, Ian. I think that's very helpful, and it gives me an opportunity to maybe refer to relatively distinct but nevertheless overlapping things there. And one is that the future intention in relation to reporting on our annual performance and indeed our interim performance throughout the year is to move to that much more narrative, story-based progress of the whole system and how all the different facets of it connect together and how they all contribute, and a sense of progress. Now, that whether that be a positive progress or not, or a progress that's more worrying, and to get away from the reliance upon everybody's individual interpretation of a number of data sets. We require to include those, partly because of statutory requirements, but partly also because it's important as background information. But they are not the unique way in which we need to be creating a narrative around about how well we are doing. So there's that point, just to clarify. And I haven't referred to that before, but again, it's just to reiterate, this is the beginning of a journey to try and create something distinct in relation to reporting on performance. The second thing in relation to, yes, you're absolutely right. As we move in terms of our mandate for in our strategic plan that we anticipate, away from that directly delivered, formally commissioned services into greater community capacity, early interventions, prevention, that kind of thing, we absolutely will need a solid and sustainable third and independent sector to ensure that actually that what we're trying to achieve can be realistically delivered. And we also recognise that we're at that pivotal moment in relation to where we have been financially and decisions that we've had to make in relation to the finances, and how that begins to potentially impact on our future intentions. And that's the reason why we have tried through Marie to create a stability in the situation from last year, which was very difficult, into this year in a more sustainable way, as we start to pivot, coming from the mandate from the public in terms of strategic plan towards a different kind of future. And we will all have to work very carefully there and closely there with that as we begin to transition from what we maybe had all been doing in the past towards something that aggregates up in relation to a much more sustainable future. So I think those two things do overlap, but I think it's important that we acknowledge that where we are is still challenging, but where we're going will continue to be challenging, but we need to try and embrace that change as positively as we can.
Okay, thank you, Tom. Can I take us? Oh, sorry, Councillor Colley.
I can't tell if that's on or not. I've got one question, and I was trying to find it there. So it's around people with anticipatory care plans. It's on page 160, and it might just be presentational, because it's not really. You can see the numbers are changing and the direction of travel is down, but it's not clear of how many out of, you know, is that as a percentage of the number of people who are receiving support, what percentage of an anticipatory care plan? Because it feels like a number isn't necessarily that helpful if you don't know what that's out of. And if some of these things are cumulative, you know, if, for example, if there's 26,000 anticipated ACP in a 23, are we building on that with the numbers that are there? But I think it's just a presentational to actually know if, for that to be a meaningful stat. And it was the only one that picked out.
Yeah, if I may, thank you through yourself, Chair. That is a very good example of data in isolation, not necessarily aggregating up to anything that you can see the interrelationship between that going down or that number in isolation and that trend somewhere else that may on the face of it not seem connected, but actually is connected in terms of what we're doing. And that's the very kind of essence that we're trying to get to in relation to future reporting, which is that the data will be all very well and it will be able to be looked at and interrogated, but actually how all these things connect together is actually the key thing that will be useful in terms of decision making for the IJB.
Okay, thank you, Tom. David, do you want to come back in?
Yeah, just coming in on that comment about anticipatory care plans. So that's the total number of people with an ACP out of the population of Falkirk. So out of 170,000 people, there's 15,000 with an ACP. GPs were, it was proposed that GPs should look to have at least 1% of their patients with an ACP. So you can see we're a long way above 1%, nearly 10% from my maths. But there was a huge surge in that during COVID, and that's during COVID we were tasked with adding as many ACPs as possible for anyone we thought might be vulnerable for COVID. So I think that falsely increased the number really, and then you can see over time that's kind of gradually coming back down to probably closer to where is sort of representative. So these numbers are a wee bit misleading. I think they used to be a very good marker up to COVID, and then it sort of skewed at COVID, just to try and explain that. Hope that makes sense.
No, that's very useful clarification. Thanks, David. Okay, can I take us then to the recommendations? So we have considered and commented on the draft report, and the other recommendation is to delegate authority to the Interim Chief Officer in consultation with Chair and Vice Chair to approve the final report for publication once the additional data are available. Is that agreed? Okay, thanks everyone. Can I move us on then to item 9, the Children's Rights Report? Farah, I think you're going to introduce this one.
Hi, good afternoon everybody. Thank you for having me along today to present the report on children's rights. The United Nations Convention on the Rights of the Child and Corporation Scotland Act came into force in July 2024, which places a statutory duty on public authorities to demonstrate that they are not acting incompatibly with children's rights. This responsibility has typically been undertaken through the Children's Planning Partnership, but under this new legislation, this has been extended to all services across public authorities. As a duty bearer, the IJB must ensure that children's rights are being respected, realised and progressed across all of our services, from budgeting and complaints handling, and across all levels of service, from that first point of contact up to strategic planning. This first report has been jointly produced between Falkirk Council and the Health and Social Care Partnership, as the transfer of services was still in progress during the reporting period. The report essentially collates the activities across Falkirk Council and Falkirk's HSCP, with a particular focus on groups of infants, children and young people whose rights are most at risk, and these are listed in the main report. Contributions have come from lead officers and amended into plain language. The target audience for the report are the infants, children and young people that are growing up in Falkirk. And we acknowledge the great work of colleagues, but also the barriers that prevent these infants, children and young people from realising and exercising their rights. The report is here before the IJB to seek approval, as this needs to be sent to Scottish ministers as part of the reporting and accountability process. We're asking for the IJB to approve the recommendations and to seek support from senior leaders to progress activities that have come out of the report. Everyone sitting in this meeting today has the responsibility of upholding children's rights, and we all need to work collectively to do our bit. I'm happy to answer any questions.
Okay, thank you, Farah. That's very clear. Can I open it up then to questions or comments from members? Councillor Hannah.
Thank you, Convener, and welcome, Farah. I think this is your first IJB. And thank you for all the work that you do, because I know you've been doing a great deal in the background. Can you just clarify a bit, how are we measuring whether children's rights are actually how this approach to children's rights is actually improving the outcomes for children rather than just being part of a process?
So in terms of measuring, that will be down to the individual services that we have worked with. So, for example, within the HSCP, there's some amazing, fantastic work that's been done by colleagues within children's services, for example. And from my interactions with colleagues, I understand that they have their own separate reporting responsibilities as well. Anyway, so what essentially this report does is collate some of the activities that are being done, but also provides that sort of action plan as well. So within the report, you'll see it is sectioned into, what's happening now and what needs to happen next. So that's been put forward by lead officers in terms of what it is that we need to work on. And the idea is that in terms of measuring progress, we will have the Equalities and Human Rights Working Group, and we do have my counterpart for the HSCP who also sits on that group, and we would be looking at it collectively in terms of how progress is being measured. Obviously, this report is a joint report, but I think going forward, because now that children's services are now within the IJB, that would be followed up separately with my counterpart. So it would be down to essentially the services themselves that would be measuring that progress and feeding that back into the next compilation of the report. So it is given that ownership to the lead officers who are already doing that fantastic piece of work, and possibly giving them support where they feel is needed, and helping them to identify gaps, and just really sort of making sure that everybody is on board, like I said, from, for example, senior management, to make sure that there's that continuation can keep going.
Thank you. It may be Farah or it may be one of our officers for my next question. But how do we ensure that those children who are most at risk, most vulnerable, are actually engaged in influencing decisions and are actually having an impact on our decision making? I don't know who's the best person to come forward on that one. Is that you, perhaps, Sarah?
So thank you for the question, and happy to support Farah as we respond to this important report that we've had come forward to both Falkirk Council yesterday and the Education Joint Board today. So we're not starting from a standing still position. Embedding children's rights has been part of our processes and our structure around babies, children and young people for as long as I know them to be in existence. Support around UNCRC and children's rights, very thoroughly embedded. Lots of really important work that's been progressed through our schools in terms of that universal position around children's rights. But the particular group of children and young people that Councillor Hannah refers to, we do have really good established networks and supports. Farah noted that the Children's Partnership have our own quite new engagement strategy in place, which is a universal strategy, but absolutely does recognise the importance of how we connect to perhaps the more at risk group of babies, children and young people. So we got some really, really good examples, particularly in terms of how we have used Article 12 and supported children to be listened to and heard. So whether that might be through the good work that colleagues are well aware of through the Champions Board, and just the sheer number of changes that actually they have influenced through being listened to, being actively heard and work taken seriously by leaders to be able to make some really quite significant changes, whether it's to policy, strategy, approach. The important part is the feedback loop. It's about making sure that it's quite hard to capture how the impact is actually felt from implementing all of this. So I know that always feels a bit disappointing, but it's about seeing it. It's about actually, it's quite tangible. We're really, really focused on making sure that we can recognise the impact, but it's hard to bring that back in a really kind of concrete way. So sorry to disappoint, but hopefully to give you a sense of the feel of this is really, really important. So schools are doing really, really great work. We do have embedded practice with those more difficult to reach groups and seldom heard groups. But this, I think, really lays down the message, which is this is work in progress. Lots more to do. This is really going to kind of help us structure it. But going back to where I started, we're not starting from this point. We've got really established processes in place. So hopefully that's been helpful.
Hey, thank you for that. Yes, it is. No, I recognise that it is really difficult to measure the outcome and even more difficult to evidence the fact that the children themselves feel as if they've been listened to and had an impact. So well done for the work that you are doing. Thank you.
Okay, thank you so much. Alison, can I bring you in next?
Yes, thank you. A really, really interesting report, and it was really nice to see the things that we are doing. So mine is actually not about the content of the report, about communication of the report. So I'm conscious that this is a report we're saying they want the audience to be the children and young people of Falkirk. And when I read the report, I can see that there's been real efforts made to simplify it and put it in easier language, but it still felt like a report for this type of body rather than a report that a child would read or would want to read. So one of my asks is really about what is the communication approach for this? How are we going to make it simple enough, or a version of this that is simple enough that will engage the young people in understanding what we are doing? So whether that is a written document, whether that is a cartoon, I don't know, the Scottish Children's Reporter do some great things in this area, but it just feels too corporate and too formalised to really engage with that population. So it was, how are we going to take this into something that will really engage our young people?
So in terms of the report, I appreciate, yes, the main aspect was to make it in plain language, to make it accessible as possible to a lot of people, and I think it really kind of opened my eyes as well when we ended up having to put in like a glossary to trying to explain what is it that people actually do, and really getting into the nitty-gritty of, you know, the certain teams and the functions, etc. And I totally understand where you're coming from. So at this point, what we're looking to do is seek approval for the wording of the report, but there will be a child-friendly version that needs to be produced as well, that will get submitted to Scottish ministers. So I'll be working with the likes of Gillian Miller and Cathy Grant from Children's Services to lead me or lead our work together essentially to create that child-friendly version that we will then have published onto our respective websites. So that is the plan, and we will get like young people etc. involved. So I'll be taking their lead because it's my first time doing this. But definitely it will be put into something more simpler, because that is a statutory requirement actually to make it child friendly, because ultimately it is for the children and young people to be able to access.
Yeah, and I think that's great, and it does need to, I'm glad that we're saying we're going to do another version that is that child-friendly version, which is great, because you can see that the effort's been made, but just it's still too complex. And I think just my other ask as part of that would be to think about the communication channels. The chances for child leading a report are probably relatively low. So how do we reach out in different ways? How do we use our social media channels? Because it'd be great to actually not just report on what we've been doing. It'd be great for the children of Falkirk to actually understand it and to use this as a way of getting them to engage more with all of those services. So that's just my ask. Thank you.
Thanks, Alison. Councillor Motta.
Thank you. And where I've not had a chance to read all the IGI papers in detail, I'm very familiar with this one because we just had it at the full council yesterday. And I won't ask all the same questions so far. I should be glad to know that I asked yesterday. But I think in terms of at a council level, we have added, for example, screening questions to our EPIAs about the UNCRC and therefore the need for a CRIA, a Children's Rights and Wellbeing Assessment. And I just wanted to ask, in terms of the kind of higher level decision making that we might make, have we also incorporated that into our processes to see where there needs to be further work done specifically to be looking at children's rights in our decision making process?
So as far as in terms of looking at CRIAs and the decision-making process, my understanding is that, so between myself and my counterpart within the HSCP, we've both worked on it together. So the process, what it is for council, would essentially be the same process for the IGIB and HSCP services, with offering the same level of scrutiny that we do for council, and that should be followed through within the HSCP services as well.
Okay, thank you. And I think obviously Sarah mentioned as well there about the embedding and that you know, there are so many examples of really good practice, and I see those examples as well. Particularly, we mentioned about the Champs board and many things which are happening within our schools, but that concern about just, I suppose, is with the general public, but actually particularly with children. The majority of children can be not great joiners in with things, and they don't want to engage at all across any level. And I think actually that to reach trying to reach the broad spectrum, it can actually be sometimes more challenging than identifying groups and bringing them in. So in terms of the embedding practice, I think training is hugely important at all levels of staff. Can you say a bit about how the UNCRC in particular, in those articles in our Section 6 duties, but how that is being embedded from an operational level, you know, across the board, not just in sort of pocket examples, but what kind of training and understanding does staff and indeed elected members and board members get for that sort of thing?
So in terms of, for example, training, there's a well-established workforce development team within HSCP services led by Evelyn Kennedy, and they do some like amazing, fantastic work, especially within the sphere of public services. Public protection, children's services. So there's quite a lot of good training opportunities that are available there for council colleagues, and they do that quite regularly, obviously because child protection, etc., falls within that remit. So there's usually quite lots of opportunities within the service to access that. So I would encourage people to, whenever they see possible, to join in with them. In terms of being able to reach and participate, get in touch with children who are less likely to sort of engage, I think sometimes that's where data comes in handy, where we are able to then assess the cohorts of young people or the groups of young people that are potentially missing from our data or from our consultation or our involvement, and then developing and working with either community groups, etc., to try and identify and target those groups of people. As I've listed the rights of those who are most at risk, we've had some really interesting conversations during the compilation of this report as well, at how we can look to capture or be more aware of certain situations which can prevent young people from taking part. So I think it is one of those things that we need to have that continuous dialogue, and it is about that feedback loop, that being able to identify where we've got it right, but who's missing, and where can we make sure that we are reaching those children and young people who are less likely to engage. But that's mostly bearing in mind that I am Falkirk Council hat, but within HSCP services, the conversations that I've had with lead officers, they tend to be in quite a lot of agreement with what's been said. But above and beyond that, the amount of work and the amount of dedication and passion that goes towards helping and supporting these young people, you'll notice, well, once this is published in Appendix 2, I've got a data set about the rights of about children whose rights are most at risk, and you'll see that there is quite a substantial number of children and young people who are already quite intensely involved, and we've got colleagues who are doing some amazing work that can definitely be shared and learned from across both HSCP and Council.
Thank you. And I think, and I always make the point that I think it's really good that we have this legislation to make sure that we focus this. But yeah, that I'm now scrolling that extra age bracket down whenever I'm coming to a forum, and yet the UNCRC came in on the time that I went to high school, and that, I think so many opportunities have been missed to do the embedding. So it's really good that we focus on progress going forward to make meaningful change. So yeah, looking forward to more progress.
Yeah, thank you. Tony, can I bring you in?
Yeah, thank you, convener. Tony Beekman from Unison. The executive summary of the report framed it in terms of a progress update and also a baseline for improvement with a view to strengthening outcomes for children and young people. I would commend that constructive and realistic approach. In terms of improvements, I had feedback from a couple of social workers, so maybe these couple of things could be looked at as the work progresses. This was to do with the views of children with disabilities or additional support needs, and the social workers thought sometimes it was easier to get the views of the parents, but a bit more work needed to be done to try and make sure we get the views of the actual children, and that make sure that their views are listened to and inform future actions. And the other concern was that there's a bit of a backlog in assessments due to staff shortages and excessive workloads. I don't expect all that to be solved today, but maybe that's something that could be added into the work as it goes forward.
Okay, thank you for those points, Tony. If there's nothing else, I think the recommendation in the paper is to note the report, but I think we're being asked to approve this for submission to Scottish Government. Is that correct? Yeah. Okay, so can I ask then that IJB approves the report?
Agreed.
Okay, thank you so much. Thanks so much, Farah. It was a really interesting report, and we'll look forward to that progress against the baseline that's been established. Can I move us on then to item 10, which is the interim care team report? Claire, welcome in your new role.
Thank you very much. Thank you, Chair. So I'll just take you through the report. The recommendation to cease the interim care team is supported by a robust review of system performance, engagement, demand and service activity. Over the past 3 months, packages of care delays have remained in Falkirk consistently low and are continuing to reduce despite sustained high levels of discharge activity and demand across the system. The evidence demonstrates that discharge performance is being driven by mainstream care at home services and strengthening discharge pathways, with the interim care team contributing to a small proportion of the overall care capacity. Given the service's limited impact on full system flow, we have identified low utilisation and a relative high cost to the care. There are operational constraints. We feel that resources can be more effectively aligned to scalable, sustainable models of care that deliver greater value, support our ongoing transformation within the partnership, whilst maintaining positive outcomes for patients. This is recognised in projects such as the Care at Home redesign and Discharge to Assess developments, as an example. The review included extensive engagement with staff, stakeholders and people who have used the service, ensuring that recommendation is evidence-based and informed by those with direct experience of the team. So we engaged with staff through surveys, face-to-face meetings and detailed 2-week activity analysis. Stakeholders across the system completed surveys and patient feedback was gathered through questionnaires. The review found that the team is very highly valued, with stakeholders highlighting responsiveness, flexibility and positive outcomes, whilst consistent excellent standards of care and feeling listened to were noted. Staff spoke positively about the support they receive within the team and the focus placed on their well-being. The recommendation before the board is therefore not a reflection on staff performance or the quality of care provided. Rather, it concluded that the system has evolved significantly since the team was established during the COVID pandemic, and the original need for this dedicated bridging care service no longer exists. The interim care team, as the report mentioned, was created to support hospital discharge when people face lengthy waits for care packages. Today, average waits are significantly lower. Our discharge pathways have improved considerably through Home First developments and improvements, and again, the transformations planned around Care at Home and the integrated discharge service. Evidence around Falkirk's delays show that internal and external Care at Home providers have the capacity to meet the current demand. The review found that the team supports around 58 people a month, typically for around 3 days, around 50 hours per week. The cost effectiveness of the model has been reviewed and it is quite significant, as detailed in the report. The review also identified that the current model does not make best use of the skilled clinical staff. The expertise is not fully utilised through care package coordination. In addition, and importantly, the service operates as an unregulated care service, creating governance risks for the partnership in comparison to care inspector regulated providers. Importantly, the review concluded that there are no system-wide gaps requiring the continuation of a dedicated bridging service. Existing services can absorb this activity, and the funding release will be used to maintain capacity and support ongoing transformation. The proposal is impacting on 13 members of staff. Through review, trade union and HR support, they have been fully involved in the process and there are no severance implications. Staff will be supported through formal organisational change process. Thanks.
Okay, thank you. Councillor Hannah.
Thank you, Convener, and congratulations, Claire, on taking on this role.
Thank you.
And thank you for your very thorough report. First question I have is about the consultation with staff. I mean, you're saying that this is we have here a really difficult issue because we're talking about a highly valued team, and you've been very much in praise of the team and the work of the team. but we're saying it's no longer needed and it's underutilised. So how much have the staff been involved in the discussions about this and the consultation?
Thank you for your question. Yes, we've had, during the time of review, we had regular meetings with staff and gave them the opportunity to attend virtually or in person to discuss the concerns around the changing landscape really of health and social care since the COVID pandemic. We've been open and honest around the concerns around efficiency. And, you know, we've been open around the concerns that we have about the service. For example, I'm concerned around the access for service users. So people that require, for example, a really high level of care, require time medication and require specific times. We're not able to meet that. So all that's been shared with the staff group involved. So they've had regular opportunities to meet one-to-one to discuss the concerns and just transparency around where the concerns around efficiency lie, as well as the changing landscape. So there's been open conversation about that.
And what's the detailed redeployment plan for the 13 staff?
Yeah, of course. Thank you for your question. So we've been working really closely with our colleagues from RCN trade unions and also HR across both partnerships and NHS Forth Valley. Staff have been offered already one-to-one discussion around options available to them and how best to support. Now, obviously, there are clear processes around NHS Forth Valley and that HR process, but we've informed them as far as possible and planned to support them with any paperwork and any strengths, requirements, wishes around the redeployment process. So some staff have taken that up in terms of discussions, others have not, but the offer's there. So there's been extensive discussion and offers of support just around what that process looks like when we're able to progress.
Okay, thank you. Now, how we heard earlier on about the overspends within social care and the demands and so on. So how confident are you that the existing care at home capacity can actually absorb this demand? Because we're talking about 58 people per month and 50 hours on average.
Yes, so thank you for your question. There's a significant demand from our hospital discharge system. The interim care team, as I've mentioned, has specific remit and criteria. So not everybody is considered for access to the team at the moment anyway. 50 hours is in comparison to a significant number of hours per week being provided. There's obviously significant transformational plans around our reablement service. So at the time that we're at now, I anticipate a hybrid in terms of running alongside, you know, the interim care team reducing their capacity, as well as our reablement service and care at home increasing our capacity in-house. So there's certainly I think assurances around monitoring the daily package of care position for our people in Falkirk and making sure that we've got mechanisms in place to meet that. However, we do have evidence from over the past 3 months that as the interim care team's capacity has reduced, that our external and internal services are providing that care and support through that clear governance via the Care Inspectorate in terms of regulation as well. That's important. Yeah, hopefully that answers. Thank you.
I think so. Thank you. So you're confident that this will not increase delayed discharges?
So if I could just add to what Claire has outlined there. So actually, in terms of our external provision, the market's completely different from when this service first came into being. So as Claire's outlined, it came into being when the COVID pandemic hit. It was a response to the fact that we had considerable demand for care at home, but our external market couldn't meet that demand. Our external markets, now that we've got 80 providers on our care and support at home framework, and we don't have an issue in terms of being able to, access external care provision. As detailed in the report, it takes around 12 hours through our e-brokerage service to actually set up a new care package. And added to the benefits, that it's a regulated care service that's got more flexibility than our current ICT team. It actually improves not just the standard of care delivery, because right now we're in a position that we've got a clinical team doing care tasks. So we've got the wrong team in the wrong place. And it's about looking at how we can best use that workforce across the system, as well as providing that, a more appropriate care service. So it's the two things combined that, have fed into this review. And we're confident. So, Claire talked there about some of the changes that we've got planned around care at home redesign. That will strengthen things. But right now, if we were to take the system as it is right now, we're confident our delays aren't around care at home. They're in other areas in the system. And we don't see that changing by this team no longer being in place.
Just finally, could you maybe just clarify this regulated versus unregulated? Because I think that it kind of gives me some pause for thought that we're talking here about an unregulated service.
So if I maybe start, so in terms of, to provide the care and the tasks that are being delivered, you would be regulated with the care inspector, you would be registered with the care inspectorate, and they would regulate that service delivery and do inspections. But obviously it was a point in time, COVID was a very different context, and services had to look at how can you meet that demand. And, at that point in time, this was seen as an option to fill a gap and meet that immediate need. So an interim care team was put in place. But, as part of it, so then that became delegated to the partnership, and we have to take cognizance of what tasks are being conducted. And that's part of the reason why we did the review, because we wanted to check actually what is this team doing? Is it actually care tasks or is it clinical tasks? And that was one of the findings of the outcome of the review. Actually, it's care tasks that are being done. And if this team was to continue, then we'd need to think about how you would do that in a regulated space, because the tasks that they're completing should be completed by a regulated care team registered with the care inspectorate.
Okay, thank you. Thank you, convener.
Okay, thank you. Councillor Colley.
Thank you. It's probably more a comment than a question. Apologies, Chair. Actually, recalling how the team was established, but I think the fact that it is unregulated and we have that assessment of the tasks that they are providing, I think that is a fairly high risk to be carrying. But actually looking at the financial aspect of it, and it really is the savings really are quite significant, that could be reinvested into wider accessibility to care services and care at home services, and I want to say that doesn't underestimate or the value of the staff, the value of what they have delivered for individuals. But I think I definitely agree with the point. We were at a point in time when the service was created itself, and I think probably everybody recalls how quickly things were developed because there was need, and every service had to respond and be kind of fleet of foot and develop things in a different way. But I think we're in a different place now. The partnership is in a different place now with shifting the balance of care, with the wider development around and review of urgent and unscheduled care, and also with the reviews around care at home. I think I just wanted to make those comments, but as I said, not in the slightest bit to underestimate or undervalue, the service that the individuals involved provided.
No, I think that's a very fair comment. It was set up to meet a particular need in a particular set of circumstances, but we're now in a very different place. Ian, can I bring you in?
Thank you, Chair. Yes, more a comment, I think, than a question. I'm mindful of the tickets horse situation, and I think it's really important here, whilst there's obviously been a very robust review and indeed consultation with the staff and service users involved, I think it's really important to have a very proactive communication strategy in place should we need it, so that we're not potentially reacting to something again from the public. So I know Paul's with us today, but I'm sure it's something that's in place, but I think it's a really important aspect in this, because we're in the danger as a board following Tiggot's Hall of people looking for what's the next thing they're going to do and what stories can we write about this. So I think it's really important to be very proactive and anticipate what may or may not come out in publicly in relation to this change if approved, and have a clear strategy in place just to make sure we can manage that.
Yeah, very fair comment, Ian. Thank you. We'll take that on board. Okay, if there's nothing else, I'm going to bring us then to the recommendations. So the recommendation is that we approve the discontinuation of the interim team and direct NHS Forth Valley through direction to implement the change, with funding reallocated to maintain care delivery through existing regulated care at home services. Is that agreed?
Agreed.
Okay, thank you. And the other recommendations are simply 2 notes, so take them as duly noted. Thanks, everyone. Thank you, Claire. Okay, I'll take us then on to item 11, which is the Health and Care Staffing Scotland Act annual report. I think, Lorraine, you're going to introduce this one for us.
Thank you, Chair. I'm understanding as Suzanne is going to introduce the report.
Okay, apologies, Suzanne.
No apologies to you, Chair, and thank you for the introduction, and thank you for the opportunity to present the report, and good morning to colleagues. So this report that's presented today is the second Health and Care Staffing Act annual report for 2025-26. The report notes that there are different reporting requirements for health and social care, and that's why you have 2 separate annual reports presented within this paper for your consideration today. And as we've noted, Lorraine is here as Chief Nurse from Clackmannanshire and Stirling Health and Social Care Partnership to present the health aspects of the report on behalf of Nicola Woods. And with your agreement, I'll cover the care element of the report. So the care report has been prepared as a joint response on behalf of Falkirk Integration Joint Board and Falkirk Council, and the cover report at section 4 provides some background to the legislation. The Act itself places duties on local authorities to ensure that there is appropriate staffing levels in place for health and care services that focus on safety, quality and the well-being of both staff and service users. At section 4.5 of the report, we note that factors that we must have regard to when we plan or secure the provision of a care service from a care service provider in the reporting year, so that being 25-26. And the Act also includes the requirement that every local authority and integration authority must prepare a report to Scottish ministers on the steps they've taken to comply with the legislation, and that's in relation to those newly commissioned services. We would note as well within the report, obviously, that this does relate to the care aspects do relate to the external provision, but services within the partnership, so those internal services, including those by the local authority, are monitored closely by the Health and Social Care Partnership, Clinical and Care Governance Management Group arrangements, and that any concerns that relate to these are escalated through the appropriate mechanisms and reported to the Performance Audit and Assurance Committee. So the annual report itself outlines our compliance with the Act. It focuses on those care inspectorate registered services where we've commissioned and procured them. And over the reporting period, there were 3 contracts that commenced that related to adult social care services, children's social care services and housing services. And those 3 services are noted at 4.10 of the covering report. We've also noted within the cover report that there are 2 reporting questions that we have to respond to in our annual report, and the annual report itself is attached to Appendix 1 and provides a response to those questions. Just to note that the Health and Social Care Partnership Senior Leadership Team and Falkirk Council Corporate Management Team have both separately considered the care report and it's now presented today to you for your consideration. The final report will then be submitted to Scottish Ministers by the 30th of June to meet a required deadline. I'm happy to take questions now if you would like, or I pass to Lorraine to present the health care report, and we can pick up questions at the end.
I think we'll just go to Lorraine for the second half of the presentation, and then we'll take questions afterwards. Lorraine.
Thank you. Thank you, Suzanne, for introducing the papers, and thank you, committee, for allowing me to come along and present on behalf of Nicola today. So from a health perspective, our overall assurance position is being rated as being reasonable. It's indicating strong systems and governance are in place, with some areas still requiring further improvement. However, although most of our duties are rated as being in a reasonable assurance position, there are elements within the report that provide substantial assurance. These are our strongest areas, and they include real-time staffing, risk escalation, and the use of the common staffing method. In order to deliver the Act, NHS Forfally uses a structured system approach, which includes digital tools such as eRostering, SafeCare, Turas and Bintana. These systems are supported by twice daily huddles within the clinical areas, and we have clear escalation pathways that escalate from local level to board level. And we also have the common staffing model, which incorporates our clinical judgment, patient need and quality measures. This tool is run on an annual basis over a 2-week period. So the key achievements from a health perspective that are noted within the report is that we are seeing improved patient safety through the real-time staffing oversight. We do have strong governance, audit and learning cultures in place, and we have enhanced staff engagement and wellbeing initiatives set up as well. And we do have more robust data now, which supports our workforce planning going forward. Our key risks that are identified within the report is our workforce sustainability and recruitment challenges. For example, we do have high levels of sickness absence, turnover rates, and we are predicting a reduced attrition rate for nursing being picked up within our local university. We also have financial pressures, which does have an impact on staffing models. And we've got variation in the use of the digital system implementation. So that's been rolled out over a phased period. So the applications and the definitions of safe staffing can vary within the clinical areas. We have had reduced protected time for clinical leaders, and that's acknowledged within the report. However, this has changed since the production of the annual report, and the protected time for clinical leaders has now increased. So our key actions is to target recruitment and retention initiatives. We do have recruitment and retention meetings and structures in place, and we're also going through an over-recruitment campaign to address the vacancies and the reduced attrition rates going into the future. We've got continued rollout of our systems. We will continue to strengthen our governance and escalation processes, and we'll increase staff training and engagement. And as mentioned, we have increased our protected learning time for our leaders. So the overall message to take away from the NHS Forfally report demonstrates reasonable assurance with strong staffing systems in place, but we do have workforce pressures. Consistency of implementation needs to be addressed, and leadership capacity remain our key challenges going forward. I'm happy for any questions.
Okay, thank you, Suzanne and Lorraine. Can I open it up for questions? Councillor Hannah.
I mean, it's obviously positive that all areas have either reasonable or substantial assurance in terms of the assessment. But I wonder if you could say a little more about the actions that are going to be taken to move those that have reasonable assurance and to deal with the issues of non-compliance. We just need to be assured that there are actions in place.
Yeah, so So the areas that we required to pick up are terms of the risks that I shared with yourselves. So the workforce sustainability is an ongoing issue for us. So like we have set up recruitment and retention processes in place. So and they meet on a monthly basis just to look at what our staffing position is. We are also introduced a deputy chief nurse to look at our sickness, absence and turnover rates. So going forward, these systems should increase our workforce sustainability. As mentioned, we're also involved in an over-recruitment campaign as well, which should bring in an increased nursing workforce. In terms of the digital systems coming into place, it has been a phased rollout, so clinical areas will be at different stages. So we will be focusing on areas that have newly been introduced and provide staff education about the use of the systems as well. We've also went back to the areas that were implemented first and refreshed that education, and we've reviewed our escalation processes as well. The protected time for leaders that I mentioned, it was a 60-40 split originally, where our clinical leaders had 40% management leadership, and that's now been changed to 80-20 split, so that our clinical leaders are able to ensure that we've got safe staffing and safe patient care. I hope that answers or gives a level of reassurance.
Thank you, convener.
Okay, are there any other questions or comments? Take us to the recommendations then. So consider the information provided in the report. Note that the care report was considered by Falkirk Council's corporate management team, and note that the information provided in the Forth Valley section has been submitted to Scottish Government. Is that all agreed?
Agreed.
Thank you. Item 12 then is urgent and unscheduled care. Caroline.
Thank you, Chair. So I'll provide a brief overview of the urgent and unscheduled care report, drawing attention to the key sections. Section 1 is the executive summary, which outlines that the report provides assurance on the development and implementation of the whole system urgent and unscheduled care plan, which was endorsed in March 2026 at the NHS Board. The plan has been developed in response to sustained system pressures, particularly around demand, delayed discharge and patient flow. It brings together a set of interdependent actions at different stages of delivery, all aimed at reducing avoidable hospital stays, improving flow and shifting care closer to home. Importantly, there's already early evidence of improvement, partly due to shifting the balance of care discharge to Assess Plus model. Moving to section 3, the main body of the report, the background outlines that the system continues to face significant pressure, driven by increasing demand, rising complexity, workforce challenges and limited community capacity. This has historically led to high occupancy and delays in discharge, increasing risk for patients. In response, partners have developed a whole system plan aligned to the national priorities such as Home First and discharge without delay. In terms of the assessment and progress part, the shift in the balance of care model is contributing to measurable improvement, including reduced delayed discharges and shorter hospital stays. They're improving trends in occupancy and flow, supporting performance across the system. The plan itself is built around 8 core pillars, including improving that emergency department flow, strengthening discharge processes, expanding hospital at home, and improving data and digital visibility. These are being delivered in a phased and interdependent way, recognising that sustainable change requires both system and cultural shifts. Finally, in terms of implications, taking finance, there's been a £2.027 million non-recurring transfer in 26-27 to support embedding the 24/7 discharge without delay discharge for assessment model. However, longer-term sustainability will require recurring investment. Without this, there's a risk of reverting to more expensive hospital-based care. In terms of workforce, there's a strong staff support for the direction of travel. However, there's pressures in community services, particularly around workload intensity, and this has been addressed through workforce planning. The plan is helping mitigate key risks, including system flow and capacity, patient harm from prolonged stays, and financial pressures from hospital-based care. But it's important to note that failure to sustain the model would increase risk exposure across the system. In terms of engagement and inequalities, there's been wide-gauge engagement with staff, partners, patients and carers, and as changes progress, this will continue. In closing and summary, the report demonstrates early positive system impact, a clear whole system approach, and the importance of sustaining investment and delivery to maintain progress. The recommendations are to note the progress in implementing the whole system urgent and unscheduled care plan and the evidence of early system impact. Consider whether the arrangements described provide sufficient assurance, and note that approved non-recurring funding transfer in 26-27 to support embedding shifting the balance of care model and the discharge assessed model, with the intention that recurring funding funding proposals will be brought forward as part of a fully developed plan, and that if this is approved, will be supported by the attached direction. I'm happy to take any questions, Chair.
Okay, thank you, Carolyn. Councillor Colley.
I'm on. Aye. Thank you. I've had the benefit of seeing this before through the NHS board, and really positive about the direction of travel and the actions undertaken to date, and obviously extremely positive about the resource transfer, which is I will say I don't think we can underestimate the fact that the relationships in this area and the activity within this area have enabled that resource transfer, and I don't think we can underestimate that work. Something popped into my head when I was reading it, and actually it was in conjunction with the Children's Rights Report, and obviously Children's Health Services remain that they're not part of the partnership, so there's something sitting separately there. But Children's Social Work Services are. And in terms of that discharge model, and I wonder just more about going forward, about how we have, I suppose, a bit more visibility around children and young people, but also about children and young people with disabilities being able to, in health conditions, who are having support on discharge from hospital in terms of social care services, what that journey looks like in terms of urgent and unscheduled care. So it's something that popped into my head. It's not something I necessarily need an answer to just now, but it does feel like there's something around visibility and children's rights within that process as we go along.
A really interesting point, and I think I can give some assurance to you about that. So as one of our transformation projects is around transitions, and the way that we are approaching that is with a really, really fresh approach to transitions. So not just trying to labour around the and grapple with the tricky issues that are very well known to us, but really, really take a very fresh approach. And a fundamental, I think, for that is that transitions is not just about the move from being a young person to an adult in that very traditional way. What you're describing is a transition point, and that, just to give you that assurance that we're looking at the kind of wider concept of transitions, so that has been taken into consideration within that transformation project. So there'll be more to see and hear about that going forward. And despite the fact that we don't currently have children's and women's health within the health partnership, clearly that's a big consideration for us, is that multi-agency working. It's our day-to-day activity. So they're very well engaged with that transitions work that's ongoing just now.
The complexities of integration. Ian, can I bring you in next?
Thank you, Chair. Just a quick question, really. I'm a very strong supporter of the Shifting Balance of Care project, and it's really, really encouraging to see the 60% figure, as in 60% of the people who would otherwise have went to long-term care have been able to remain at home or return to home. And I just wonder if there's a mechanism to maybe monitor those individuals over perhaps the next 6 to 12 months, because if we can demonstrate that this has actually got a bit of sustainability and those people who have been able to return to home are able to do so for a prolonged period of time, I think it'll only strengthen the evidence for this activity and maybe help with further support moving forward.
So if I maybe take a response to that, so that's something actually we're looking at, because obviously we have to build a business case for the next year, and I think that's one of the key metrics we want to show, not just the people that have been supported for this current financial year, but also what's been the impact for those individuals that we supported the previous year. So it's that kind of longitudinal, I can't say the word today, it's a long term, about looking more about the impact, what it's been just for that first cohort of individuals that were supported, but also the current people that are going through the system. Because the other thing that we recognise, the system's evolved, so that, the service that we're providing is always improving, always evolving. And we're very much taking that PDSA approach as we continue to improve. And I think there's probably lessons to be learned from that first, group of individuals that were supported. And that's part of the reason why we're looking at that, but just to provide reassurance that that's part of the work that we're doing, Ian.
Great, thank you. And of course, there are financial benefits as well as benefits to the individual that we can track. Councillor Hannah.
Thank you. Thank you, Ian, for highlighting. I'm going to highlight it again because I actually think it's the thing that jumps out about this, that 60% of the people who would previously have gone into care homes have been able to be supported at home. And I think that is, it's an astonishing figure. And more power to the officers and the service that has achieved that, because for those individuals it's a major thing to be able to stay at home rather than going into a care home. As I say, it needs said, 60%, I'll say it a third time. However, there is a real risk if we don't get this funded on a recurring basis. And I wonder if you could say a bit more. I know you talked about the kind of proof that you're trying to put together to make the case for funding on a recurring basis. But first of all, how confident are you? I mean, it seems to me that with figures like 60% for a fourth time, the argument should be fairly strong in terms of getting funding on a recurring basis. But how confident are you that you'll be able to do that? And what are the contingency plans if that is not achieved? Do we have any?
So what I would say is that obviously we've talked a number of times this morning about that relationship that we've got with colleagues in NHS Forth Valley and our council colleagues as well. The conversations we're having with them are on the assumption that this will happen. So I'm fairly confident that that business case coming forward with the evidence that we have, and the PAC committee's heard the outcome paper around that as well, and with that deep dive that we had and the patient journeys and videos and things which are available on our website. So I think we're fairly confident that we'll be able to make that case, and current planning assumptions are taking that into effect. If there is never no risk, so if that happened, we would have to take measures to reduce the amount of capacity in the community that we have, because we wouldn't be able to afford to keep paying for that. So we would have to manage that through our resource allocation panels, and that's not something that we would be keen to do, obviously. So hopefully we would be able to make the case accordingly to continue it.
And looking at it from, that means that's really positive to hear that you're as confident as you sound in it going forward. I suppose the next question then is there any capacity for extending it and increasing this very valuable approach?
So I think, yeah, absolutely, those conversations are continuing around whole system changes and what might be next. Caroline's talked this morning about the care at home redesign and that reablement approach that we're looking at as well. So we're hopeful that that'll continue and that'll allow us to maximise the use of our resources in the community for that. I've talked as well about we're thinking about what might primary care help us with. What can we do in primary care that's currently being done in secondary care? So we are exploring additional options and continually thinking about what might be next. And it feels like we're pushing an open door at the moment. Around that, because of the success of the shift in the balance of care. I think we're absolutely having reasonable conversations about what might be next and what are the possibilities.
Thank you for that. That leads nicely into my third question, which is the capacity within primary care, because the social care capacity is one part of it, but we are all well aware of the funding issues within primary care. And is there adequate capacity, and have we got plans for ensuring that there is adequate capacity in there for dealing with the increased demand?
Yep, through yourself, Chair. Thank you for that. I think the question of capacity within primary care has shifted in the last wee while in relation to previously the question was, is there funding in primary care or diverted funding to primary care in order to increase and enhance the capacity? We're now in a position where with the investment, a combination of the investment monies, and I also include in the investment monies the walk-in centre rollout monies as well, and imperatives there. We now have another challenge, which is actually about recruitment of GPs, recruitment of ANPs and a variety of other professions, and getting folk in place in order to meet the capacity demands is actually becoming more of a challenge than we might have previously anticipated. And I guess a lot of that is that familiar thing about over a long period of time, although students were coming out, people were graduating, there weren't jobs, so gradually less and less people were going through those training, and therefore we're now at a stage where we've got less people and the money is now beginning to flow. And people have heard me talk before about trying to manage expectation that the investment monies is incredibly welcome, but it may take a year or so before we're at the point in which we begin to see people coming into the system in order to try and meet the underlying issues that have led to the investment. So I think the shorter answer is that we understand what the challenges are. And we do see that there is ways through this in terms of increasing the capacity within primary care, but that will not happen overnight. And it's just a case of us working through the different ways of delivering, as well as the utilisation of what we've already got as efficiently as we possibly can.
Okay, thank you. I look forward to further reports on this. Thank you, Convener.
Thank you. Claire, did you want to come in on this point?
It was actually around shifting the balance of care, and I suppose some of that reassurance and evidence and data that we're collecting, if that's okay, Chair. So just in response, Councillor Hannah, I think part of the project was around maintaining and sustaining Falkirk's position around our delayed discharge profile and looking really closely at people's outcomes. And I think Falkirk, we can be saying over the past year, has really maintained and sustained a more positive position. And there's been wide system improvements, but I certainly think shifting the balance of care has been really essential and key to that. So it was just to provide assurance around our current position and how we're continuing that, which will all be evidence to support future business cases around that. I'm looking very much at an evidence-based approach. So what we should be seeing and what we are seeing in Falkirk is people's care home stays actually reducing, which is saying we're actually supporting people more in the right place at the right time in terms of their needs, and supporting really just that assessment process. So all of that evidence will come forward within that business case. So it's just to provide some assurance around that real evidence base that we're collecting at the moment. Thank you.
Brilliant, thank you. Amanda.
Thank you. It's just that we've had recently, obviously, with the shift in the balance of care and connection with carers, are feeling that the care companies are quite inconsistent a lot of the times. Carers are feeling really under pressure and their health is suffering, and they feel as though they're trying to deal with crises quite a lot if the care company's not meeting their needs. So it's putting a lot of pressure on carers, and we're hearing some quite really sad stories at the carer centre. So it's just to see how you're kind of measuring that, and carers still don't seem to be aware of that they can change their care company. They're quite scared to do that. For some reason, it's I think a Scottish thing. We don't like to complain, but carers, I think it's going to be more people with care at home. So I think supporting carers and the cared for person to know if things aren't working out would be important.
So thank you for raising that point, and I have met with representatives from the carer centre around the issues around care providers, and what I would reflect is the majority of care that's delivered is of a good quality, and and supports people to live at home in the way that they would want. I think there's two issues. The first is about making sure that we're aware of the concerns, because we can't do anything about the concerns if we're not aware. And what we're looking at is how do we, make it more accessible, the partnership, about, sharing the concerns and providing reassurance. So no one should be frightened to raise concerns about the provider or to change the provider. The other part of it as well is around that offer around self-directed support, and making sure that people are aware of their rights around self-directed support and know that they can, they've got the power to change their provider, but also they've got the power around choice and control. And that's something that we're really focused on, that kind of promoting self-directed support. We recognise it's an area that we need to continue to, doesn't matter if you've done one presentation or, one campaign, but actually what we need to do is we need to have that continuous message. So I'm quite happy to pick that up again and look at how I can strengthen that area further. But I recognise what you're saying, and it's an area we're actively working in.
Yeah, I think when it's unpaid carers and it's maybe family members that don't live with that cared for person, it's them knowing the information, how they can go about things, because they feel like they need to not complain about it or take it to an ombudsman.
So I don't want anyone to feel like they have to go to an ombudsman to people should be able to have their voice heard. And have that kind of power and control around what they want to happen in terms of their care needs in life. So I'm quite happy to pick that up and look at, maybe having a conversation and looking at how we can really strengthen that and take that forward, and maybe, share that within the IJB at a future meeting.
Yeah, that would be good, because I think Charlene's picking up a lot of carers who are obviously coming in with stories about care providers. So obviously we want it to be people are getting really good care at home. Oh, yeah, thanks. Thank you.
Okay, thank you. Can take the specifics of that up outside the meeting. In a spirit of repeating oneself, I've said repeatedly that shifting the balance of care is what health and social care integration was always supposed to be about, and it's taken us an awful lot of time to get here, but we have kind of got here, and the evidence so far is really, really positive and supports that direction of travel. So I'm going to take us to the recommendations. So to note the progress in implementing the plan, to note the approved non-recurring funding, excuse me, and the intention that recurring funding proposals will be brought forward. Is that agreed?
Agreed.
Thank you. Okay, we've had a good discussion on that. Thanks very much, everyone. Can I move us on into item 13, which is the communications and engagement update? Paul, welcome.
Thank you very much, Chair. Yes, I'm here to present the quarterly update, which provides ongoing monitoring of the implementation of the partnership's communication and engagement strategy and its associated joint action plan advertiser, and in this period focused on the early development of our next 10-year strategic plan, the formal launch of a new integrated cancer support way pathway, and the change implemented within Housing with Care at Tiggettshaw. The partnership's consultation activity during this period also focused on the development of the new strategic plan, This has involved a public survey which received responses on Participate Plus and through paper returns, a series of staff sessions, feedback collected directly from teams, and by engaging with carers, local organisations and community groups. And through these efforts, we've managed to engage with around 750 people at this stage of the consultation. So we'll soon publish a summary of views gathered at phase 1 ahead of a draft plan being put to a second stage of consultation later this summer. And in terms of other upcoming activity, we will be engaging on with the carers, with a new carer strategy due. And as discussed earlier in this meeting, we'll be progressing several pieces through the transformation programme, some of which have taken their first initial steps of evidence gathering, including the care at home review, community-bedded care review, and the integrated out-of-hours review as well. And across all of those transformation pieces, we're coordinating comms and engagement approaches to ensure that lessons learned are being consistently applied to all of our work. So the report also includes a full list of media coverage received and events held provided at the end of the report. And then lastly, I would just want to mention that this is quite a short quarterly report, but the next report due will be an annual review of progress against the comms strategy and engagement strategy and the action plan, which will be an opportunity to assess progress before the strategies are due for renewal next year. So that's it for me. So I'll just return us to the recommendations which are consider and comment.
Thanks, Paul. Some excellent work outlined in the report, as always. Comments, questions from members? Councillor Hannah.
Thank you, Convener. Thank you for this, and I think it's important. It is an excellent report, and I think it's important to note that there have been significant improvements in our communication and engagement over the time that I've been on this IJB, which is now 4 years. So I'm really pleased to see that improvement level. Obviously, there's still a long way to go, and we can still do more, but it is vital that we ensure that we are doing that. I just want to, as I always like to do, add as a local councillor in the Braes area, a reminder that when there are events, to always remember and bring in an event in the Braes, because I think there's a tendency to think about localities, and the localities are rather large, and you need to think very carefully about making in-person events as accessible as possible, because that's going back to some of the criticisms we've seen in the past. The in-person approach is really, really important. So congratulations on your improvements and keep up the good work.
Okay, thank you. So we were asked to consider and comment on the report. I think we've done that. Thanks, Paul. We'll look forward to the annual report coming through at a future meeting. Can we move on then to item 14, which is the Performance Audit and Assurance Committee assurance to the IJB. Sorry, Ewan.
Thank you, Chair. Performance Assurance and Audit Committee met on 12th of June. Apologies for my error in the date of the title. It definitely was the 12th of June. As June tends to be, it was a really comprehensive agenda, as can be seen in the report, not least because the two public-facing annual reports come through at that time of the year, and we've already considered the annual performance report here today. In terms of highlights, Pat considered in detail the Quarter 4 performance report, including emergency department performance, absence, whole system flow, and delayed discharge, including some focus on adults with incapacity issues and promotion of power of attorney. There were further actions agreed, including requests for a deep dive into emergency department rates and a request for further information in relation to the financial implications and impact of absence rates across the partnership. As I mentioned, considered the two public-facing annual reports and approved the unaudited annual accounts for issue, including the annual governance statement. approved the internal audit plan and considered national reports and inspections overviews, considered the revised strategic risk register and a strategic risk improvement plan, a detailed report from Clinical and Care Governance Management Group, and also received and considered a detailed annual report for the Keep Well service, which included some powerful information on impact of the service and video case studies demonstrating both the impact and strategic alignment and ultimately better outcomes for people going through the service, which is what we're all here to try and achieve. Impact members did specifically want to highlight that report to the IGB, and we have also shared some of the case studies and messages from it on our public facing website. PAC were assured from the information presented to them and the answers given to them at the meeting. Thank you, Chair.
Thanks, Ewan. It seems like a very lengthy meeting, some big items there, a number of which we've seen on today's agenda as well. Councillor Hannah, anything to add?
I commented on the day, and I'll comment again that a lot of the material that comes before the Performance Audit and Assurance Committee is fairly dry, but obviously very, very essential for us to be assured that everything is being properly scrutinised. So I was really pleased at that particular meeting to have the deep dive into the Keep Well service. I had heard of but didn't really know a huge amount about it. If anyone has not looked at the material on the website, I would recommend it. It's an incredibly positive service which targets disadvantaged people in disadvantaged areas and giving early intervention and encouraging people to take action on their own health. And it was a really positive item on our agenda, and I can recommend you to look into it because it was very, very interesting.
Okay, thank you for that recommendation. Any questions or comments? We're happy to receive that report.
Agreed.
Okay, thank you. So, final item on today's agenda is the commissioning and contract monitoring report. As always, because that is a report that contains commercial information, I'm asking the IGB's approval to take this item in private. Is that agreed?
Agreed.
Okay, so we'll just take a second so we can stop the recording and make sure there are no members of the public present. So we'll be back in just 5 minutes. Thank you.